Let's talk about post-COVID depression, anxiety, and mental health. Though I don't believe in depression because it's all in the head, and if you're mentally strong, then nothing can happen to you. And using Patanjali products too. Like if you have a lot of Patanjali products, you are immune to most of the diseases. So having Patanjali products is an added benefit. So use Patanjali products. Jokes aside, psychiatric problems post COVID is extremely common. 1 in 3 people post COVID have neurological and psychiatric problems. 1 in 3, which is extremely common. A lot of people tend to ignore these problems because it's hardly discussed and people aren't very educated about it. So today with me I have Dr. Dhananjay Chavan, who has an MD in psychiatry and a fellow in geriatric psychiatry. Now go and Google what is geriatric psychiatry. So in this video, we will discuss post-COVID mental health, how common it is, what are its symptoms, when to seek help, what are some taboos and myths surrounding it, and if this is left untreated, what can it lead to? So who can better explain this than a psychiatrist himself? Jaggi can. Let's move on to the video. First question is, how common is post-COVID depression or mental illnesses?
Post-COVID, depression and anxiety are very common. As many as 25% of the people who suffer from COVID get depression or anxiety. Headache also is very common. Fortunately, severe neurological sequelae are not common. They are very, very, very rare. So that's good. But depression and anxiety, though they are very common, they are often overlooked. The person doesn't realize that this is direct consequence of COVID, and that is often left untreated.
Okay. And so what are the possible reasons for this to happen, this mental illnesses post-COVID?
Post-COVID depression and anxiety are direct effect of the virus on our brain. So our mental state is a function of our brain as much as it is also a function of our surroundings. So there are a medical or biological component to it, and also there is environmental, psychosocial component to it. So what happens is during COVID infection, the virus is known to affect lungs, but it also affects brain. As we know, many people suffer from loss of taste or loss of smell. So this loss of taste and smell, they also affect quality of life. And that has a huge impact on quality of life. That's another separate issue.
Okay.
There is also significant depression and anxiety.
Third one is, what are the symptoms to look out for in case like you come across it? How do you identify it?
Generally speaking, after the COVID infection is over, the person starts recuperating. He gets energy or she gets her energy back. But if there is persistent low mood or tiredness, loss of interest, irritability, feeling overwhelmed, feelings of guilt, excessive anxiety about getting another infection or getting COVID again, or excessive and persistent anxiety about near and dear ones getting affected because of the raging pandemic. So whenever these things are persistent and they start affecting one's sleep day after day for weeks, or they affect our social functioning, family functioning, our occupational functioning. For a student, it affects their studies or academics. So that is when we have to take it seriously and seek a professional help.
When you are at home, how do you cope up with it? And after what point do you think you should, seek help?
Generally speaking, if you are low mood, loss of interest, irritability, persistent feelings of helplessness, hopelessness, worrying, if your appetite is getting affected, and if this is going on for more than 10-15 days, then it is time to seek help. If it is persistent, then you have to seek professional help. Generally, if say day after day you are getting better, your mood is getting better, then you don't have to worry.
And what will happen if this is untreated? What might be its impact?
We don't know exactly how this progresses because this is a new virus.
Yes.
But based on all that we know about depression, generally an untreated depressive episode and episodes of anxiety leave some kind of adverse effect in the brain. In the short term also, there are issues of low mood and anxiety affect our immunity. So that's always there. There is issue of quality of life goes down. Our function is impaired. So those are in the short term. And in the long run, we don't know whether the person becomes prone or at risk to get similar episodes in future. But that's a possibility.
And what about the taboo which is surrounding around taking mental health help, like just taking help from people? So there is a big taboo regarding this, that if you're mentally strong, then you can't get depression. So what about that?
I think you have hit the nail on its head. Many people think that if you are mentally strong, then you shouldn't get any of these psychiatric conditions, especially depression and anxiety, which is totally false. Your personality and mental strength have nothing to do with whether you are at risk of getting a depressive illness or whether you are getting an anxiety disorder. These are totally different things. Just like anybody can get diabetes, anybody may need lenses, to read or to see at a distance. So these are medical conditions. And the impression that people carry that by mental strength alone I will fight it is wrong. And that prevents them from seeking help. I will give an example. Like 20, 30 years back, so many Indian women were not wearing glasses, even though they needed glasses, because there was a stigma attached to it. Okay. But now everybody wears glasses because now people know that if a woman is wearing glasses, she needs glasses, it doesn't make her a lesser woman. So now even young models, young women, they happily go around wearing glasses. Just 20 years back, that was not the case. So more and more we realize now that your personality strength or mental strength and your risk of getting a depressive illness are two separate things.
And what if someone is denying to go to or denying to take help? How in case, how can we convince them to seek help?
One thing that you can tell people is that this is an illness like any other illness. And unfortunately, it's not just about depression. So many times we find people whose blood sugar level is elevated and they don't want to start treatment because somehow they want to wish it away. So many times we know people whose blood pressure is elevated and they don't want to take treatment. And there are these wrong impressions people have that, oh, my blood pressure is raised, but I don't want to get used to the medicines. This is totally wrong. You don't get used to the medicine. You start harming yourself. By not treating these illnesses, you harm yourself, you harm your brain, you harm your heart. So similarly, what you can tell them, you can explain a medical model that this is an illness like any other illness. And if treated in time, it improves your quality of life. It improves your future also because it protects your brain when you take treatment for depression. Untreated depression then can lead to more severe episodes in future. Future episodes are more resistant to treatment. And now there is some emerging evidence that there may be an increased risk to dementia if one has multiple depressive episodes and which are left untreated.
What do you think about misinformation regarding this pandemic and this mental health or anything?
I think not only about the pandemic, about everything. When the whole World Wide Web came about, so many people thought that now information access is going to be so good and everybody will get the right information. But what has happened is that it has helped information as well as misinformation.
Yeah.
So there are some simple rules I would advise. First, use social media only to stay in touch with your friends, to share some clips, jokes, some humor. You like a song, you share it. So let social media be just for this purpose of staying in connection with your community, with your people, with relatives, with friends. But if you want information about something, then go to an authentic newspaper website. Another thing one has to remember is that if you find a particular news item only in one media, one newspaper is highlighting it, and nobody else is saying it. Say tomorrow I say that I have found a cure for a particular disease, and then one newspaper carries it, but none of the other newspapers are carrying it, then it's likely to be false.
Okay.
So we all know what big newspapers are, authentic sources are. So go to authentic sources. Don't use your social media for information on science or medical science, especially about diseases. Ask your doctors.
And you especially see even on news channels right now, when it comes to mental health, there, psychiatrists aren't called for it. Some other people who are, so gurus will be called and this will be called.
This is another issue that we have in any society, that experts are not necessarily good at sort of putting themselves forward. Okay. So people who appear on media are, so how many of us even know? I will challenge any young man in India to name 10 Nobel Prize winners in science. So many medicines we take, life-saving medicines, so many vaccines that we have taken since childhood, which have helped us. We don't really know about the scientists behind those vaccines or those medicines or those treatments. So this is common. What we should remember is that even television, I advise my friends that they should use television only for entertainment. To watch a movie, to watch songs, to watch sports. But if you want news, my personal feeling is that print media is a little better because it does not sensationalize news. Yes, television tends to sensationalize news, so they want to catch you there and they will breaking news. And every time something new keeps coming and the scandal after scandal is thrown at you. And then the next day you read newspaper and you say, oh, there is nothing like that. So it is for us, incumbent on us to trust reliable sources and not to go to all these other sources for our information, especially about science news. Wait, check out. There are many authentic sources all over the world. Most of them are free, and you can go and check. You can ask your friends, hey, why don't you check on this? Is this really a magic remedy? I don't understand. Say China says that this particular jadi booty in China is magical. Yeah. And the rest of the world doesn't think it is magical. Then are Chinese some different people that it only works for them? So anything that is promoted only in one country and the rest of the world doesn't accept it, then you have to look at it askance. That maybe, there is a lot of false pride in every country and every state and among communities. So you have to be careful with that.
And recently with vaccination, like right now we are having short of vaccines, but in the US now what's happening is a lot of vaccination happened. Up to 60% of the people are vaccinated. But after that, vaccine hesitancy has started to hit in, where people are, avoiding vaccines because they're anti-vaxxers. So in India also right now, that's not an issue because it's less, but it might start in the future. So how do you combat that?
You have to understand that vaccines are one of the biggest contributions of science. The longevity that so many of us enjoy, at least in part, due to vaccines. Vaccine is a well-established science and they are very safe. If you look at cost-benefit, the risk is minuscule, almost non-existent, I would say, compared to the benefits. I have octogenarian parents and both of them have taken vaccines. So vaccine is very safe, especially COVID vaccine, because there is so much attention given to it. So much data has been generated. Millions and millions of people around the world have taken this vaccine. The cases of problems that have probably emerged are not even confirmed. The other day somebody said, oh, somebody was taking a vaccine and he had a fainting attack. There are people who get fainting attacks from any injection. There is something called a blood needle injury phobia. So people, they can't stand it. So such people have extreme reaction, syncopal reaction to injections or sight of blood. It could be such a thing. I don't know what it was, but confirmed adverse effects to vaccine are almost non-existent. Severe effects. A little bit of fever, body for a day or two is okay. So vaccines are safe, they are good, and by taking a vaccine, you are not only protecting yourself, you are also protecting your near and dear ones, and you are also rendering a social service. So vaccines are very safe. Anybody who says otherwise is not paying attention to reasonable people. One thing that I must mention here is that just because somebody uses a doctor label or says that I used to work in NASA, there are always exceptions. So science doesn't work like that. How science works is, if I say something, then other doctors, other scientists cross-check it. When so many of them cross-check it and verify the data, then they come forward and put it forward, okay, this is it. Not one person just because he's so great. Even one person, there can always be a mistake from one person. So just whenever just one person's testimonial we are trusting, as against the combined wisdom of the researchers and scientists, then we are making a mistake. So even if I am saying something and somebody likes me, oh, Dr. Chavan is a good doctor. But if what I say does not tally or match with what the scientific community is saying, they should not listen to me.
Post-COVID mental health is quite ignored today. So we must talk about it and let people know how common it is. And if it is left untreated, it can lead to future problems. So whoever is having these problems, tell them about it and ask them to seek help. And share this video as much as possible so that people know that there is a problem like this. It exists and it needs to be treated. So let me know in the comments, how did you like this episode? And if you think I should keep calling experts in fields, so I'll try to do that as much as possible. If it's possible, I'll try to do it for sure. So let me know in the comments, how did you like this video? And that's about it. Subscribe to the channel. A lot of you still haven't subscribed. Please subscribe, liking is also important, and share the video. And that's about it. Thank you everyone for watching the video. See you guys in the next one.